Welcome to Talking Ketamine, episode 14 of the Deep Dive. Today, we're taking a closer look at something many of you have asked about, the real experiences, the personal stories of people who've done ketamine-assisted therapy. We really want to dig into how their journeys, and maybe more importantly, their outcomes, might be different from getting ketamine without the talk therapy part alongside it.
Exactly. We kind of know what ketamine can do pharmacologically, but what does it actually feel like for someone? What does it change when you combine it with therapy? What shifts do people notice? Are they lasting? That's what we're trying to get at here.
Right. And we're basing this discussion on a really interesting study. It's called Understanding Change Following Psychedelic-Assisted Therapy, a phenomenological study. Basically, they did these deep interviews with 10 people, 10 individuals who'd had at least 6 months of ketamine-assisted psychotherapy at one specific clinic.
Yeah, and just to be clear, we're not giving medical advice or anything like that. The idea is to understand, what brought these folks in, what happened during the therapy, and what stuck with them afterwards.
Yeah.
Especially around managing emotions and sort of their general well-being. We want the real lived story.
Okay, so let's start there. Motivations. What was driving these individuals to seek out this specific type of therapy? What were they looking for?
Well, one thing that really stood out was just how much many of them were carrying. A very common theme was a long, often really painful history of trauma. Things like abusive relationships, neglect growing up, deep-seated issues with self-worth.
And these weren't small things. They often led to ongoing depression, anxiety, PTSD, just this chronic emotional pain that wouldn't lift.
Right, so this wasn't their first stop then. They'd likely tried other things. Oh, absolutely. That was another major point. A real sense of frustration, almost desperation, because traditional therapies hadn't really worked for them long term. Things like standard medications, CBT, even EMDR. And they often said, look, my previous therapists were great. They helped, but the relief didn't stick. The core issues remained. So they felt hopeless, really, and started searching for alternatives.
Yeah.
Ketamine therapy came up as, well, something different.
That feeling of being stuck, working so hard in therapy, but still caught in the same patterns, that resonates, I think, for a lot of people.
It really does. And then for quite a few people in this study, there was another layer. Physical health problems, things like chronic pain, maybe long COVID, complications from surgeries, or even just the physical results of, unhealthy coping mechanisms. It adds another dimension, doesn't it? When your body isn't cooperating, it can really mess with your sense of identity, who you are.
Yeah, that makes total sense. That loss of identity when you're ill or injured, it must amplify the emotional stuff.
Exactly. It all kind of feeds into each other. And one more thing about their motivation, it's quite telling. All the participants in this particular study, they paid for it themselves, out of pocket.
Wow. Okay.
Yeah, which suggests, a pretty significant level of investment, maybe even desperation, right, to find something that clicks. And interestingly, a few mentioned wishing it was covered by insurance to make it more accessible.
So you've got people carrying heavy trauma, often physical issues too, feeling failed by other methods and putting their own money down. That really sets the stage for hoping this will be different. Okay, so what did they experience when they were actually in the ketamine sessions with the therapist?
This is where it gets really interesting. A really big theme was profound emotional release. People describe these intense moments of catharsis, like grief or trauma they'd held onto for years, suddenly surfaced and could be, well, processed, felt. And it felt truly transformative, not just like, oh, I understand this better now, but a real release. There's some thinking, that ketamine might boost neuroplasticity temporarily, make the brain more open, which could help explain why these releases felt so, well, deep.
So not just talking about the feelings, but really feeling them maybe in a new way and letting them go.
Exactly. But it's crucial to say it wasn't one size fits all, not even for the same person from session to session. People really emphasized how different each experience could be. Sometimes it was calm, introspective. Other times, intense visions, symbolic journeys. Often unexpected emotions or insights would just bubble up, things they hadn't even realized were there.
Seems very unpredictable, but also deeply personal, tailored almost by their own mind.
That's a good way to put it, yeah. And another huge piece was working on core beliefs. Those really ingrained negative ideas about themselves. The I'm not good enough stuff, the guilt, the shame. And the therapy, often helped by the ketamine state, seemed to allow breakthroughs there. Finding more self-acceptance, a stronger sense of self. Some even talk about meeting younger versions of themselves, but with compassion this time.
Do you think maybe the altered state helps quiet that inner critic, allows for that compassion?
That's definitely a possibility people talk about. Maybe that usual judgmental part of the brain gets turned down a bit. And then there's this concept, ego dissolution. Some participants described it. Moments where that fixed sense of me, my story, my defenses just sort of loosened, became less rigid. It allowed them to observe themselves, their thoughts, their life, almost from the outside. One person said it was like being on a balcony watching.
Wow, stepping outside yourself like that, I can see how that would offer a totally fresh perspective on old problems.
Precisely. It creates distance, maybe. A space to see things without the usual emotional charge or the usual defenses kicking in.
Okay, so these are powerful experiences during the sessions. But the big question is always, did it last? What happened afterwards in their day-to-day lives? Did these moments translate?
Yeah, and that's where this study, focusing on the psychotherapy aspect, is really insightful. The participants reported really significant lasting improvements in emotional regulation, so things like anxiety, getting really angry. They didn't feel so overwhelming anymore. They described feeling more equanimity, more balanced, a greater capacity to handle life stresses without getting completely derailed.
So not just feeling good right after, but a genuine change in how they navigated their emotions long term, like upgrading their internal operating system.
That's a great analogy, yes. And it wasn't just emotions. Many talked about healthier relationships with, say, food or alcohol, less compulsive behavior. And this seemed tied to an increase in self-compassion, just being kinder to themselves, making healthier choices overall. It suggests a real shift in how they related to themselves, more care, more acceptance.
That points to some deep internal changes, doesn't it?
It really does. And relationships with other people change too. Participants mentioned feeling more able to set boundaries, clearer, firmer boundaries, and finding that past traumas didn't dictate their present interactions as much. They weren't getting triggered in the same old ways.
That's huge. Being able to navigate relationships differently.
Absolutely. And it wasn't passive. They seemed actively involved in keeping the momentum going. Many talked about adopting or strengthening practices like meditation, journaling, tools to kind of reinforce the changes and continue the growth.
So they were integrating the insights, actively working with them.
Yeah. And underpinning all of this seemed to be this fundamental shift towards more self-compassion, like we mentioned, but also just a stronger sense of self-worth, recognizing their own value, separate from past experiences or what others thought, moving away from needing that external pat on the back, that validation, and focusing more on their own goals, their own internal sense of okayness.
That shift from external validation to internal fulfillment, that's pretty profound.
It is. It speaks to a much more solid foundation of self-acceptance. And maybe one of the most touching things was this increased willingness to be vulnerable, to actually open up, form deeper connections, let go of some of those old protective walls. One person used this beautiful phrase, they called it an exchange of egoism for humility.
Wow, exchange of egoism for humility, letting down the guard to connect more authentically.
Exactly. And you saw this reflected in the language they used overall.
Yeah.
People consistently described the whole process as a turning point, a catalyst, life-changing, a profound transformation. These weren't small words. They really felt fundamentally different.
Hearing these stories, it really does offer a sense of hope, doesn't it? Especially if you, listening, are dealing with pain that just won't budge or feel like you've hit a limit with other therapies. These accounts suggest other possibilities exist.
Absolutely. It's 10 people in one study, of course.
Yeah.
But their experiences offer really compelling insights, especially about combining ketamine with dedicated therapy.
So let's just recap quickly. We talked about the deep-seated reasons people came to Katie: trauma, frustration, sometimes physical pain. Then the experiences themselves varied, intense, involving emotional release, shifts in core beliefs, sometimes that ego dissolution, and crucially, the reported lasting changes: better emotional control, healthier behaviors, improved relationships, more self-compassion, and this move towards internal validation. And it really seems like the combination, the ketamine plus the therapy, was key for making those changes stick, for processing the past and really redefining themselves.
Yeah, it definitely gives you something to think about. It might resonate with your own experiences or questions about mental health treatments. And it certainly encourages looking more into the research that's happening in this whole area.
Definitely. So this deep dive into these personal stories, it gives us a powerful glimpse into what healing and growth can look like with this approach. It leaves us with a thought, perhaps. Sometimes, understanding someone else's journey can light up potential paths for our own.